Hi, my name is Amanda, and I will be talking about tattoos, body piercings, and non original hair color in the workplace. Now, we all may personally have body art or know someone who does, and we may not have a negative perspective or judge people based on these factors. But the research I found shows the perspective that some patients may have and why organizations may be opposed to nurses being allowed to have tattoos, body piercings, and different hair colors. So, for a long time, there has been a huge stigma around tattoos, piercings, and non original hair color in general. But as times change and cultural norms evolve, tattoos, body piercings, and different hair colors may become more acceptable in the workplace. As of today, this topic is still heavily debated, and there are still restrictions in the workplace. So, I will be sharing some of the research that I found on why there is opposition to tattoos, piercings, and non original hair color in a professional setting. So, the first study that I would like to share is assessing dental clients' perceptions of dental hygienists with visible tattoos. And this was done in 2016. So, 203 dental clients were surveyed, and they were shown three pictures of dental hygienists, models, in scrubs. The first picture was a model who had no tattoos. The second picture, the model had a small wrist tattoo. And in the third picture, the model had a large sleeve tattoo. Clients rated professionalism based on these pictures, and they also rated their willingness to use that dental practice. Clients also answered if they themselves had a tattoo or not. The results of this study showed that large tattoos were seen as less professional and they were negatively perceived. Clients were also less likely to use a practice where that person in the scrubs, that model, had a larger tattoo. Smaller tattoos were seen as more acceptable, and these answers were shared by people who had tattoos and people who didn't have tattoos. Um, so, this study suggests that tattoos should be considered on a case by case basis. Some implications for nurses based on these findings would be that because client retention is so important, organizations may not want to lose clients and they may enforce stronger restrictions on tattoos. The next study that I would like to share is perceptions of visible body art among radiographers, and this was done in 2020. So, radiography clinical preceptors in the hospital setting were surveyed about tattoos in the workplace. There were 943 responses from radiographers in the US. The results of the study showed that acceptance of body art was lower among people without tattoos. People who covered their tattoos had lower acceptance of tattoos, and medical related tattoos were more acceptable. Some implications for nurses based on these results would be that clients without tattoos may be less accepting of tattoos, and this could negatively impact the trust that the patient may have for the nurse and create a negative perception of the nurse. The last article that I would like to share is Perceptions of Midwives with Visible Body Art. And this was written in 2018. So in this article, there is a study that I found very interesting shared. So they cited this study that was done in the United States, and the study involved 158 college students that rated pictures of individuals with tattoos more negatively than pictures of people without tattoos. And this suggests that tattoos have a negative impact on interpersonal perceptions. In phase 1 of the study, the participants identified a model with a tattoo as less attractive and caring than a model without a tattoo, who was also perceived as more athletic and intelligent. In phase 2, the tattoo was smaller and less intimidating, such as a dolphin rather than a dragon. And this resulted in less extreme reactions. However, the model without a tattoo was still perceived as being more honest and religious. So, this study recommended educating students of the possible long term implications of having a tattoo and how it can impact their employability and the perceptions that clients or even their senior colleagues at work may have on them. And all that I mentioned was from a study done in 2008, and it's cited below in my references. And some implications that these results from that study can have on nurses is the negative perceptions that people may have on tattoos, and this can vary on the type of tattoo as well. So, in conclusion, these are the reasons why nurses should not have tattoos, body piercings, and non original hair color in the workplace. Most studies I covered talked about tattoos, but as a whole, these three things have a similar stigma. So, reason number one is that it can negatively impact a client's perception. A nurse can be viewed as unprofessional, less caring, or less intelligent. Reason number two, it can negatively impact the client's perspective of the organization as a whole, as we represent our workplace. And reason number three is that having these things can limit a nurse's job opportunities. Some organizations may have stronger restrictions on tattoos and piercings and non-original hair colors. So they may have less job opportunities if they're unwilling to cover, or if they don't want to, if they're not interested in working somewhere with those restrictions. And reason number four would be that we care for people of different cultures, beliefs, and age groups, and having what is most perceived to be a professional image based on studies and research is important to making a patient feel safe and trust their nurse. So after watching this presentation, I hope that you understand why tattoos, body piercings, and hair color can be seen as negatively in nursing. Thank you.